As we have already discussed the muscles on the anterior aspect of the thigh, so talking about the anterior and medial compartment of the thigh, now we are going to talk about the muscles which are located on the medial aspect. So talking about the medial aspect of the thigh, we have muscles such as the obturator externus, pectineus, gracilis, and the adductor muscle group. Sometimes we also include sartorius in the medial muscle group because of its complex arrangement. So as we already mentioned, we have the pectineus, adductor longus, adductor brevis, adductor magnus. These three muscles actually form the adductor muscle group, the gracilis, and obturator externus. So if we take a look at this picture here, so at the topmost we have the obturator externus, then the pectineus. This is the pectineus, but it is not actually labeled here. Then we have the adductor brevis, the adductor longus, and the largest of them all, the adductor magnus. So pectineus, gracilis, obturator externus, and the adductor group, which consists of adductor brevis, adductor longus, and adductor magnus. And as already mentioned, that sometimes we may include sartorius because of its complex arrangement in the thigh, which is that it starts off at the anterior aspect and moves towards the medial aspect, and perhaps for that reason we can consider it as a muscle of the medial aspect as well, but we already discussed in the anterior aspect. So the origin is from the anterior superior iliac spine, and that is the reason that it is also involved, and one of the most commonly involved muscles in the hip pointer or the hip pointer injuries in contact or collision sports. And the insertion is on the proximal aspect or the proximal medial aspect of the tibia. The functions include hip flexion and lateral rotation, as well as knee flexion, and the nerve supply is from the femoral nerve L2 and L3. Talking about another muscle, which is pectineus, it is not a very large muscle, it is small, and it is located on the medial aspect, and the origin is from the superior ramus of the pubis. As we already discussed that the pubis has two rami, the superior and the inferior rami. So its proximal attachment site is from the superior ramus, and then it moves on laterally and inserts on the pectineal line of the femur, which is actually named after the pectineus muscle. And the arrangement of this muscle actually designates its action. So if this muscle contracts, it's obvious that it would move the femur in the hip adduction, which is a double deduction. So the function of this muscle is hip adduction as well as hip flexion. The nerve supply of this muscle is via the femoral nerve, via the L2, L3, and L4 nerve roots. Another muscle which is very thin but very long, which is the gracilis muscle, and it also arises from the pubis, but on a more medially oriented location, and then it moves straight downward and inserts into the anteromedial surface of the proximal end of the tibia, pretty much close to the sartorius. And its function is majorly in hip adduction, and the nerve supply is via the obturator nerve, via the nerve roots L2 and L3. Then we have a very small muscle which is located in the, you can say, the obturator foramen, and it is the obturator externus. And the proximal attachment of the obturator externus is from the rami of the pubis and the rami of the ischium. And the insertion, it moves from medial to lateral and attaches on the trochanteric fossa, which is the greater trochanter here, and there is the trochanteric fossa where it attaches. So it moves from medial to lateral in a posteriorly oriented direction, and the innervation is via the obturator nerve. Now, talking about the adductor muscles, just like when we talked about the muscles on the anterior aspect of the thigh, we said there is a major group of muscles which are known as quadriceps femoris, which was a group of 3 muscles. Similarly, adductor muscles is once again a group of muscles, and it has 3 muscles in it, including the adductor brevis, the smallest one, the adductor longus, and the biggest, which is the adductor magnus. So let's start off from the adductor longus muscle. So adductor longus arises from the pubis and it inserts laterally to the middle third of the linea aspera. So once again, just like the obturator externus, it also moves slightly posteriorly because linea aspera is present on the posterior aspect of the femur. And the nerve supply is via the obturator nerve, and the nerve root includes L2 and L3. Talking about the function of the adductor longus, it is perhaps very intuitive to just see from this slide and the orientation of the adductor longus muscle, that because of its orientation, it's very obvious that it is one of the major adductors of the hip joint. Moving on, talking about the adductor brevis, it is perhaps the smallest of the adductor muscles, and the origin is once again from the pubis, and the insertion is again on the pectineal line and the proximal linea aspera. So it attaches pretty much close to the pectineus muscle, which is also one of the adductors of the hip joint, and it also moves slightly posteriorly, just like the adductor longus and obturator externus, etc. So its attachment is slightly superior to the adductor longus as well. And the function, once again, it is very obvious from its orientation that the function is hip adduction. And the nerve supply is once again via the obturator nerve, and the nerve roots include L2 and L3. And the largest of the adductor group is the adductor magnus, as you can see in this picture as here. And the adductor magnus is a bigger muscle, so it has a bigger attachment site. So its proximal attachment includes both ischium and pubis, especially their inferior parts, and their if you talk about the distal attachment site or the insertion of the adductor magnus, we have the entire linea aspera as well as the adductor tubercle, and the adductor tubercle gets its name because of the insertion of the adductor magnus. So entire linea aspera, because it also moves slightly posteriorly. So talking about the function of the adductor magnus, as obvious from its orientation, it is once again hip adduction, and as obvious from its name as well. And because it's a large muscle, it is supplied by two different nerves. One is the obturator nerve and the other one is the sciatic nerve. And talking about the nerve roots, we have the L3 and L4. So that was all about the muscles located on the medial aspect of the thigh, in which we talked about different muscles and their action as well as their orientation and function and their attachment sites. And I hope you learned something new out of it, and keep on watching sqadia.com for more lectures like this. Thank you very much.